This is the awful, confronting reality of Tourette syndrome for Bianca Sayers.
Mario here, Scientists Without Limits. From observing all these patients with Tourette syndrome, I see a pattern of behavior apart from the uncontrolled muscle movement that differs from the Parkinson condition. With the Parkinson condition, all these muscle movements are rhythmic and with a noticeable shaking pattern similar to a epileptic spasm or muscle tremor or shivering, and I notice the movements are involuntary, unlike the muscle movements caused by the Tourette syndrome. I notice patients with Tourette have the immediate desire to move or think out loud. Also observing that some of these uncontrolled movements are all involuntary, but still projected. I notice the calming effect of a drug can aid with this type of condition, like the case of cannabis, where observing that after a dose is taken, all these patients maintain normal muscle movements without any twitch or tic. And also, I observe their level of stress is reduced due to the drug calming effect, and this tells me a lot that this is a problem that originates in the area of the brain that controls electrical activity of voluntary muscles, but it goes even deeper to a frequency level where there are alpha, beta, and delta waves that basically control the circadian rhythm or biological clock that tells the body when we are supposed to sleep and where we are supposed to wake up, and all this happens at a frequency level. With the Tourette syndrome, but not the Parkinson, it's still uncertain if these stressing factors also affect and alter the involuntary muscles controlled mainly by one of the intracranial nerves that control heart rhythm, respiration rate, pulse, etc. Like, for instance, when a person is fully awake and active, there is a brain wave called beta. When people are asleep, there is a brain wave called delta. And when a person is falling asleep or just waking up, there is a brain wave called alpha. And the threshold or bridge between delta and alpha, or alpha and delta, is called theta, which is the hypnotic state. When a patient with Tourette or Parkinson is experiencing stress, it means he is fully awake and alert, and this further causes stress, and this stress causes the brain to cause nerve pulsations that causes the tic or uncontrolled shaking or movement of the upper limbs. But also, I have noticed that the patients with Parkinson can walk without ticking or shaking their lower limbs and only manifesting epileptic-like spasms. Unlike patients with Tourette, it's not a tic, more like a severe jerking movement. How the drug cannabis affect the central nervous system to the point that the patient with Tourette or Parkinson that is fully awake and alert is able to sustain and control all these muscle spasms has to do 100% with their beta brainwave, because the evidence I have observed with these patients demonstrate that when these patients are asleep, their muscle spasms cease completely from the moment they wake up, which is the threshold in between delta and alpha, and during alpha mode until beta mode is set, which is when the muscle spasms start manifesting. The surgical procedure called DBS, or deep brain stimulation, where a device is placed sort of similar to an endocardial pacemaker that help patients maintain a normal heart rate without extrasystoles or AV blockages, causing and prompting the myocardium to enter a state of fibrillation. Observing these patients, it caught my attention when I noticed that with a service dog, the ones that stroked the most did not manifest the urge to strike the service dog. So I asked myself, what part of the brain is involved in causing her not to strike the dog the way she strikes everybody else? I noticed from observing different type of patients with Tourette syndrome that all patients' symptoms are different from one another, and that not all patients manifest the same symptoms, where some are more aggressive than others, and depending on the level of irritation or immediate stress level.
What's so confounding about this neurological disorder is when the tics can and can't be controlled. Putting on ice skates is almost impossible, but on the ice, playing with her brother Tim, Bianca's a different girl. And for a brief moment, this is a happy family.